I'm Dr. Nathaniel Chin, and you're listening to Dementia Matters, a podcast about Alzheimer's disease. Dementia Matters is a production of the Wisconsin Alzheimer's Disease Research Center. Our goal is to educate listeners on the latest news in Alzheimer's disease research and caregiver strategies. Thanks for joining us. Welcome back to Dementia Matters. Today I'm joined by returning guest, Dr. Victoria Williams, a clinical and research neuropsychologist in the Division of Geriatrics at the UW School of Medicine and Public Health. Through her work, she helps diagnose memory and thinking problems in older adults by providing cognitive testing and assessing healthcare decision-making abilities. And her research investigates how health and lifestyle factors affect brain aging and cognitive decline. Dr. Williams was previously featured on the podcast in 2024 to discuss the fundamentals of neuropsychology, which we'll link down in the show notes. But today she joins us to discuss capacity testing, as well as give a preview of her upcoming talk titled Cognitive Testing and Brain Imaging Explained for the Wisconsin ADRC's Healthy Living with Mild Cognitive Impairment series happening on September 12th, 2025. We'll link information about the event and how to register in the show notes as well. Dr. Williams, welcome back to Dementia Matters.
Thank you, Dr. Chen. It's so lovely to be back. I'm really excited to talk to you today about the topic of capacity and to engage with your audience again. So thanks again for inviting me.
And for our listeners, Tori and I work together in the memory clinic. So going forward, I'm just going to call you Tori, if that's all right.
As long as I can call you Nate.
Absolutely. All right. So let's start. As a refresher for our listeners, what exactly is a neuropsychologist and what is involved in a neuropsychological evaluation?
Yeah, that's a great question to start off. So a neuropsychologist is someone who is trained in being able to assess brain behavior relationships. And what I mean by brain behavior relationships is all observable behaviors that we exhibit, including thinking and cognition, is deeply rooted in the functions of the brain itself. And so neuropsychologists will use different types of pencil and paper tests to evaluate different types of thinking skills, which we kind of break down into cognitive domains. So things like memory and language and attention and executive functioning. And so what we're looking for is when an individual shows a pattern of poor performance in one of these specific cognitive domains, it can mean that the part of the brain that supports that function or ability may not be working functionally or as well as it should due to pathology or a disease process. And so this is really all based on this principle of localization of function, where we know that specific areas of the brain or even networks involving multiple regions are really responsible for specific types of thinking abilities. So a quick example, we know that our memory abilities are very reliant on our temporal lobes and also the hippocampus within the temporal lobe. Both of these can be impacted early on in Alzheimer's disease. But more related perhaps to today's topic, so decision-making ability. Decision-making really falls within this domain we call executive functioning, which is pretty much what we like to group as things that contribute to higher level thinking. So decision-making really evaluates multiple options in order to select a preferred course of action. So that's kind of how it's defined. And it can be highly influenced by individual factors such as person's past personal experience, their emotions at the time, or even the context of the decision itself. And all of this integration really relies heavily on the frontal lobes.
And so, Tori, I think you know that when I meet with patients, I'll say, well, you met with Dr. Williams and she's a neuropsychologist. She's an expert in how the brain functions. And so you just validated how I describe your role. But also, it's not just how the brain functions. I mean, you're talking about the anatomy too and the different parts of the brain. And so you really understand when a person has a symptom, where exactly in the brain there might be a change. And then you are an expert in being able to kind of probe and see with testing, is there really a difference or what pattern of change are we seeing here? Is that right?
Yeah, exactly. And, I like to refer to myself as kind of an early MRI machine. I mean, now we can look at an MRI and see exactly like where a stroke may have happened in the brain. But things like Alzheimer's disease, sometimes the pathology can be so subtle that you may be experiencing these changes in cognition prior to being able to see evidence of that on a scan. And so that's where neuropsychology is still very relevant. So, it kind of gives an overall view of how all different areas of the brain are working. And it's looking for areas that are performing worse than what we would expect, given how somebody else may be performing in all the other areas.
Well, then let's get into decision making. And so, what does healthcare decision making ability actually mean, and what parts of the brain are involved in that function?
Well, this is a great question. So, first, we'll just clarify that healthcare decision making ability really does mean any type of decision making that's related to somebody's medical care or treatment. So, it's specific to the medical arena. So, the types of decisions you would be making in your doctor's office about your treatment or even your decision not to receive a treatment, and just kind of weighing all of that information about how you'd like to move forward with your health. Thinking about kind of what parts of the brain are involved in this function, I think it's probably first important to kind of break down what are the different parts of healthcare decision making ability, because there are four major kind of tenets of that, and then going through after and trying to link that to some different brain areas specifically. Medical decision making is really broken down into four major tenets or components that are important. And so the first would be understanding. Understanding is really important as the first step in making a decision related to your healthcare. And so understanding is really the ability to kind of comprehend the information that a patient is being presented with regarding both the condition itself that needs to be treated, as well as the different treatment options that are available. And so this is, can the patient understand what the medical issue is, the severity of it? What are the potential risks and benefits related to each of the different proposed treatment options, including the choice to not really engage in a treatment at all and just to not treat the condition? Understanding as far as what brain areas are important are really relying on receptive language and language comprehension. So being able to understand what's being spoken to you just at a fundamental level, as well as being able to comprehend the information itself. And so it's always important for doctors to try to avoid the jargon when you're explaining a condition or explaining the treatment options, so that you really can promote a patient's ability to understand what you're trying to express to them. The second tenet is appreciation. And so this is whether the patient is able to really apply any relevant information about their own self or their own situation to the decision at hand. Do they have the insight to appreciate the disease itself, what that means for their future state or others involved in their care? Could they imagine what it would be like to have one treatment versus the other, and how their life may differ, whether they choose one or the other? So it's really this relying on brain areas that are important for kind of awareness. So, awareness of your deficits. This is something in psychology we tend to call insight or metacognition. So, it's an ability to kind of appreciate, your current state and imagine yourself in future states. The third tenet is reasoning, and I think that that's probably the meat and potatoes of making a decision, is really the reasoning piece of it. It's really whether the decision that a patient arrives at can really reflect a rational reasoning process. It's able to kind of weigh outcomes based on their personal values. I think later on we can talk a bit more about the value piece of it, but really the rational reasoning piece is really important. So can a patient weigh the risks and benefits to arrive at an option? Is this consistent with the kind of goals and plans they would have for themselves? And so reasoning is really relying on actually frontal lobe functioning. In order to reason, you have to integrate a lot of information, and you have to do kind of comparative processes of how is this one better than this one. It's very reliant on that kind of control center of the brain, which is the frontal lobes. And then finally, the last tenet of decision making for healthcare is expressing a choice. So once you've understood the information, appreciated it in context of your situation, and kind of engaged in that reasoning process, are you able to express what your decision would be related to that kind of medical situation? This is probably the most simple of the four tenets, because it really in the brain really just relies mostly on kind of expressive language. But, it is something that you want to be able to assess over time to make sure that their choice remains consistent.
And so, Tori, each one of these kind of leads into the next one. So you can't really make a choice if you don't understand or appreciate. You can't reason unless you've appreciated and understood what's been said to you, right?
Right. Well, at least to make a valid or or a good decision. I mean, certainly people can express a choice without engaging in any reasoning, and that's exactly what we're trying to avoid when we assess for capacity. But a good decision would each part would build upon another.
So then how does healthcare decision making ability differ from other decision making abilities like everyday judgment?
Yeah, that's a good question too. So, judgment and decision making are very closely related. And in fact, judgment is actually a core component of the decision making process. Judgment really involves the ability to kind of evaluate information in order to inform an opinion. So, you can have a judgment about your own state. You could also have a judgment about what you think somebody else would do. However, where it differs is really decision making is actually the process of choosing a course of action based on that judgment itself. In other words, lapses in judgment often lead to poor decisions. And so when someone's starting to show kind of poor judgment or decision making in their day to day life, it's often actually an early indicator that they would likely struggle with kind of healthcare related decisions as well. So that's one thing to kind of keep in mind. And then as far as kind of how it differs from other types of decision making, so I think there is important to note that healthcare decision making really just falls under this much larger umbrella of what we call civil capacities. And these basically refer to like the legal power granted to individuals in order to make decisions for themselves. So this is a basic human right. And there are a range of specific capacities that have been defined. I'll kind of give the list of them now. So what we've been talking about so far today is healthcare decision-making capacity. There's also financial capacity, so making your own financial decisions. Testamentary capacity, which is engaging kind of with contracts like making a will. Independent living, so ability to decide whether you can live independently or whether you might need to be placed into higher level of supervised care. Driving, of course, that's always an important topic. And even kind of less known capacities that we may not think of on a day-to-day basis. So the capacity to consent to a research study, for example, that's its own area, as well as even kind of capacity for sexual consent. So these are all areas with very defined tenets or prerequisites to meet criteria for those capacities.
Some of our listeners might have heard of the word competency, Tori. And so, how does capacity differ from competency?
Yeah, that's actually a really important distinction. And so capacity exists more in the clinical or non legal setting, whereas competency is very specific to a legal setting. And so capacity is something that is determined by a clinician judgment. So healthcare decision making capacity is something that can be assessed by a clinician and is based on a judgment by that clinician of whether they kind of meet that criteria or not, versus competency, and that's actually a legal determination. So that's determined in a court of law. Competency would be something you would assess for like guardianship, for example. And they're based on the same principles. They just have kind of different levels of evidence needed to kind of get to that point. The other way that they differ, the most important way they differ, is that competency in the legal sense is a very black and white determination. So a person either has competency to make their own decisions or they do not at all. Whereas capacity in the kind of healthcare clinical setting really exists on a continuum. A patient can have capacity to make very simple decisions, especially those that may be rooted in kind of long-standing values or just their preferences. So for example, being able to create a new kind of healthcare power of attorney, oftentimes that really relies on kind of long-standing values and people they feel comfortable with and have known for a long time, and they can give a good reason for why they would choose that person. However, something more complicated, so a really high-risk medical treatment procedure where they may have a high risk of dying, for example, that would really increase the risk. And so they may lack capacity for these more complicated medical decisions where there may be a lot of information or complicated information to consider. But more simple decisions, kind of based fully on preferences, they tend to really retain for quite a while.
And so, Tori, this really speaks to two common issues that come up in healthcare. And one is a person having capacity to make a healthcare power of attorney, but then not having medical decision making capacity afterwards because of the complexity of perhaps a certain procedure or thing that's happening to them.
Exactly.
That is a rational thing. Okay.
Yeah, I see that all the time as well. And I think, what really is helpful in kind of thinking about that is, capacity determination is really a delicate balance between promoting a patient's autonomy to make their own decisions about their life and their health and their health care versus protecting them from risk of harm due to kind of poor decisions that they may make that could be related to changes in their brain. Oftentimes, things like changing a healthcare POA, I mean, it may represent kind of less risk. Whereas decisions related to complicated procedures or those with high risk of harm, they may need a bit more support for those sorts of decisions by, a loved one or somebody who can help them work through that decision.
And then you brought up the word guardianship in this
Yes.
answer to competency. And that speaks to something you said earlier in your prior question, where you mentioned that one of the different tenants dealt with healthcare, but then also separately living environment. And so we see a lot of people having an activated power of attorney or lacking medical decision making capacity. And then families, unfortunately, thinking that that also means, well, I can actually move them into a care facility now. And that's not actually the case, right? So those are two separate assessments.
Exactly. And that's where that legal piece really comes in. So, as I said, Capacity is really clinician judgment. And so it really just gives a designated person the legal authority to be involved in somebody's decision making process, but in no way does it actually force any individual to follow through with that treatment. There's no way that a clinician would hold a patient down and make them do something, even if their power of attorney is saying to do it. I mean, and that's an extreme example. But with guardianship, though, the guardian does have the legal right to actually make decisions that can be followed through with in the legal setting. So that's an important decision. And even though a power of attorney may disagree with the you can't force a patient to kind of leave their setting, and that's when really guardianships become necessary. And those sort of determinations are really determined by a judge in a court of law.
So then when does someone typically lose their healthcare decision-making ability?
Well, there is no hard or set rule for this, and it really varies. So it's important to remember that decision making capacity is both situation and individual specific. Lacking medical decision making capacity can occur in kind of more limited medical situations. For example, you have a patient who presents to the ED and they have delirium, for example, or they have acute psychosis or something that's time limited that is impacting their ability to think and reason through things. And so in that situation, the capacity evaluation is really targeted towards that immediate situation and medical decision at hand. Once that resolves, so delirium is defined by it being kind of a set course. So people experience a decline in thinking and then that returns back to normal. The capacity determination can be reversed and they regain capacity to make their own decisions again. So it's restored. So it can be kind of a time limited and very situation specific sort of assessment, but it's a little bit trickier though with individuals with dementia. And the reason for that is that dementia is a very progressive and chronic disease. And so we expect that its effect on thinking skills tend to kind of persist or even actually decline over time. And so, once we were able to show that a patient is having trouble making certain types of complicated decisions, we wouldn't necessarily expect that to improve over time. The other thing to keep in mind, because you asked about when would somebody actually lose their ability, and I said it's specific. I mean, it really depends on what part of the brain is being affected by the dementia syndrome itself. Some individuals, even with mild cognitive impairment, can lack capacity for decision making, specifically if they have some sort of pathology that impacts those higher level functions of the brain. So, the reasoning and kind of executive higher level thinking that really is important for decision making. That part of the brain really helps us synthesize this competing information, like being able to weigh the risks and benefits of different options, to engage in that comparative reasoning across the options as well. And so there's certain conditions where the frontal lobes can be affected quite early on. In fact, it's one of the first symptoms that we start to see. So frontal temporal dementia, for example, is one where someone may have a tendency to lose their decisional capacity earlier than someone else who may have later implication of the frontal lobe. For example, Alzheimer's disease, typically the early symptoms in Alzheimer's disease is trouble with memory. And I think what's really interesting to point out is that oftentimes people just associate dementia in general with lacking capacity, but it's really specific to that individual and there's no set course. We do know that it's more common in moderate to severe stage. And when someone does reach that point, it's a really good idea to start routinely assessing capacity, expecting that at some point it may start to fail. For Alzheimer's disease, the way that disease process affects capacity could be entirely different than, say, somebody with either vascular or frontal temporal, where you may have trouble with the reasoning. So in Alzheimer's, a lot of times, and one of the earlier symptoms that people may see within the dementia spectrum is kind of a lack of insight into their cognitive deficits. So they may no longer have the ability to recognize that they're having trouble with their memory or thinking. And this can in turn impact the tenet of appreciation. So because they're having such severe memory problems, they're really having a hard time picturing what their future self would look like because they can't keep in mind kind of what their situation actually is. Again, there's no hard or fast rule for when somebody will lack capacity, but, moderate to severe stage dementia is when we typically want to kind of look out for it the most.
And you mentioned, assessing it pretty routinely after a person reaches such a stage. And so can any clinician assess healthcare decision making, or is this an evaluation only conducted by specialists?
That's an interesting question. I just want to start by pointing out that actually assessing healthcare decision making capacity is a core tenet of informed consent for any medical encounter or treatment. So anytime you interact with your doctor, there's this assumption that you have capacity to make medical decisions related to that visit. The ethics code for medicine is to do no harm, and part of that is knowing that anytime you interact with your doctor, your decision to engage in a treatment for a condition requires a person to be informed of the risks and benefits, be competent to understand that information, and that this decision is made completely voluntarily. So really, every medical encounter should involve a capacity assessment, and most of the time, this informed consent piece is really just implied. The doctor wouldn't specifically assess for decision-making capacity at every visit, but doctors do tend to become concerned for a lack of capacity when the patient is exhibiting things that they kind of set off some red flags. So, for example, if they're not aware of their medical conditions, if they're refusing medical treatments that the doctor feels could really benefit them, or, if there's reports that they're showing impairments in their judgment and other day-to-day activities. So those could all raise flags where a doctor may want to specifically kind of dig in and look for healthcare capacity at that visit. But in the setting of dementia, this can be a little bit problematic. And that's because oftentimes patients, if they are agreeable to a treatment and they're not kind of putting up a red flag, doctors may assume that they have capacity where in reality they may not. They're, as long as they're going with the flow, there's no reason to kind of step in and really grill, well, why are you accepting this treatment that I'm recommending? So, just kind of a word of caution. Oftentimes, a patient could be lacking capacity, even though it's not being fully assessed. But when it does get to the point where a provider really feels like a capacity evaluation needed, it's generally kind of just a conversation between the doctor and the patient. In that setting, during the visit, the doctor would likely ask the patient a lot of questions about assessing how well they're able to kind of understand their medical situation. So what are your medical conditions? How are they being treated? If there's a new treatment option that's being discussed, kind of how well can they understand those and appreciate how the treatment would affect their life and day-to-day care, and also kind of evaluating their reasoning process for how they arrived at that outcome. So mostly it's just kind of a conversation that doctors have with patients. One other point about this is in order to actually activate somebody's healthcare power of attorney, assuming they lack capacity for medical decision making, it oftentimes requires actually two signatures. A physician may be, assessing capacity in one visit, but to make sure that that's a really valid conclusion, a lot of these legal documents for activation actually require a second independent evaluation by another physician, just to make sure that that's the right way to go. And again, that's really just to really protect the patient's core right of, having autonomy over their own decisions.
And just to be clear too, Tori, that psychologists, PhDs can assess capacity, and then advanced practice providers in at least some states, I know in Wisconsin, they can sign off on an activation form too. So it's a certain level of training, but many providers can do it.
Absolutely. Yes. I'm sorry if I overlooked that point because it's really important. Sometimes different forms will specify who is allowed to do that assessments. The standard form in Wisconsin allows for psychologists, physicians, as well as nurse practitioners in order to make those sort of judgments. But just be careful because some power of attorney forms, either created before 2011 or who, were created outside of the standard template, may be a bit more specific actually and kind of what's required to activate them.
And so then, now that we know more about the forms or the process, how do you actually assess this clinically when you do it?
Yeah, so I actually created a clinic specifically focused on assessing healthcare capacity. So, as a neuropsychologist, I really specialized in these kind of objective assessments of cognition and thinking skills. And because medical decision making at its nature is a cognitive process, I developed a way to really kind of dig deep and to look at the different cognitive processes that underlie each of these skills, while also using more kind of objective measures or capacity instruments to look at break down a patient's decision-making process into those tenets and seeing if they really meet the criteria for each one of those based on their responses during an assessment with me. The other thing I wanted to mention too is that, I specifically work with patients diagnosed with dementia. And so I make it a point to accommodate things that may be limiting their ability to demonstrate their ability to make an informed healthcare decision. Oftentimes patients with Alzheimer's disease will have early memory loss. But if you think back to the four tenets, memory is not one of those tenets at all. And so just because a patient can't remember their medications or remember what medical conditions they have, it doesn't mean that they don't have capacity to make their own medical decisions. So oftentimes, if you give them, a written description of what the medical issue is that they have, and write down and kind of organize for them what the treatments are, and list out what the risks and benefits are, basically reduce all the demands on memory, patients can still engage quite well in that reasoning process to make a decision and express a choice that are based on kind of valid reasoning and thinking skills. I always make a point to kind of accommodate that. And oftentimes I kind of use this a medical vignette, which is like I present patients with a pretend medical situation, give them the treatment options, and then ask them very pointed questions about how they kind of weighed the risks and benefits to arrive at their answer. And then I guess the final piece that may differentiate my approach from maybe kind of a standard assessment of capacity, like in an office visit with your doctor, would be that I really take a pointed effort to fully assess a patient's longstanding values and their preferences related to healthcare decisions. And it's really important to know if kind of the nature of the decisions they're making in the moment are aligned with the types of decisions they've made in the past. Patients are allowed to make what other people may consider to be a bad decision. And this can be for several reasons. So patients are allowed, they're autonomous. They can decide for themselves that, they want to, not engage in a treatment because they typically haven't been trustful of healthcare, for example. Another example would be, sometimes people might refuse a blood transfusion because of their religious preferences or beliefs. And so even though that decision may disagree with what I would do for myself as an individual person, it doesn't mean that they can't provide a rational reason for why they're refusing the treatment in that situation. Bad decisions are allowed as long as they can show adequate reasoning for why they arrived at that decision, as well as their values and preferences kind of support that type of decision in the past.
In one of your earlier answers, you did allude to this, but I want to go a little bit deeper. And so it sounds like you can lack capacity in healthcare decision making, but then not necessarily in some of the other tenants or the other domains that you listed. But in particular, if you lack healthcare decision making, does that mean you likely will lack financial decision making too?
Yeah, that's a good question. So each civil capacity really should be considered completely independently of all the others. They each have kind of separate criteria and things that you want to look for when in each of the different areas of decision making capacity. However, I think that some skills like judgment and reasoning really are kind of a theme that you can pick up in every single one of them because by nature, the idea of making a decision does require those skills. I would say that if you lack decision in one area, there's probably a higher probability you may lack it in other areas, but you can't jump to that conclusion. And each one should be independently assessed by itself. Unlike healthcare capacity, financial capacity is kind of broken down into two different domains. So those consist of things like financial skills. So basic skills, can a patient count money, balance their checkbook, know how to make a transaction at the store? So basically kind of handle money in a day-to-day situation. And then the second piece is financial judgment. So do they have a good conceptual knowledge of their financial situation, their investments? Are they vulnerable to financial exploitation or scams or undue influence? Both of those different areas should be assessed. And as you can tell, they're actually quite different than the idea of kind of looking at healthcare, where you're more looking at a specific decision and weighing risks and benefits related to a treatment outcome.
Yeah, I appreciate that answer, Troy, because it's just not fair for us to assume
Yeah.
that because you lack in one domain, you're going to lack in the other. We should really, and of course, in healthcare, you're not always asked to assess for financial decision making, but sometimes you are, and so it's good to know that we
Yeah.
should differentiate them.
And one other kind of nugget about the difference between healthcare and financial is that, healthcare, as we discussed, requires two providers to sign off to basically activate that document. Whereas with financial power of attorney, that document is actually activated upon signing. And so it doesn't require an additional assessment. So once you give someone a power of attorney form and you put their name down, legally that person is already situated to serve as a power of attorney for your finances. Oftentimes, you'll get a little bit of pushback from the bank or other financial institutions where they're going to want a letter from the doctor saying, yes, this person has dementia and they could use some assistance with their finances. But technically, the power of attorney for finances is fully activated upon signing. So that's another key difference I think most patients aren't quite aware of up front.
And what signs should caregivers or loved ones look for in a person with cognitive impairment that may need or that may indicate they need an assessment?
Yeah, so I think earlier we discussed a little bit how lapses in judgment, kind of in day to day sort of scenarios, are really related to kind of decision making as well. When we start to notice that a patient is making poor judgments in other aspects of their life, that can really be a red flag. So, a patient who all of a sudden refuses to take their medication, or participants or patients that we encounter that all of a sudden are making really risky driving choices or having trouble kind of handling an emergency situation. Any sign in a day-to-day life that a patient may be struggling with kind of understanding or reasoning through something is typically a good indicator that they may benefit from capacity assessment. We also mentioned earlier how sometimes patients with Alzheimer's disease may start to show a lack of awareness or appreciation of their cognitive deficits, when there's a mismatch between kind of the patient's experience of, my memory's actually fine. And then their family members who are saying, well, he's asking me the same questions 5 minutes later, that could also be a good indicator, because someone who lacks awareness of their cognitive deficits may have trouble appreciating the impact of medical decisions on their, future life or state. And then finally, kind of just trouble understanding information can also be a red flag. So if you're noticing that, a loved one with dementia is really having trouble understanding complicated information just discussed in day-to-day conversations, they likely would also have trouble understanding more complicated medical issues and treatments as well.
Well, so knowing that, then how do you recommend families approach a loved one when they're worried that their loved one may be lacking decision making ability?
Yeah, and that can be a really, really tough situation. I can just speak to kind of how I approach it with patients when I see them in my capacity clinic. I often find it really helpful to first just remind them of what the purpose of these advanced care planning documents are. So, emphasizing that this is a process that they initiated and they specifically were able to choose people whom they trust and who know them well, who they feel could help them make decisions where they no longer able to do so. So I think kind of putting it as, you're the one who created this form and this was, your idea. That's always a good way to start off. I also really emphasize that activating power of attorney for healthcare is really intended to provide them with support and to, protect them from potential harm. And that throughout the process, even if you have an activated healthcare power of attorney, patients are still encouraged and always included in conversations about their healthcare needs, and always encouraged to kind of speak up about what their preference would be as well. And then finally, I also like to bring up with patients that, healthcare capacity really is a continuum. The activated power of attorney may only need to step in for these more complicated or high risk sort of medical decisions, and that patients should routinely still be consulted for their decisions related to kind of more simple or less risky sort of medical decisions as well. And, I just want to, I guess, summarize that by saying that capacity determinations are really just this delicate balance of, promoting the patient's autonomy with protecting them from harm. As a loved one, just being able to show that we want you to be as autonomous as possible, but we're also worried about you being in harm because of possibly a change in your ability to make decisions.
And so then what can people with cognitive decline and their families do to best prepare for this potential change in the future?
Yeah, I think probably the most important thing is to make sure that you have all of your advanced care directives on file with your doctor and your hospital. And these include both healthcare and financial powers of attorney, which really allows the patient to kind of select someone who they know well and who knows them well and who they'd really fully trust to make decisions consistent with their own wishes and longstanding values. It's also really important to have, detailed discussions with loved ones about their preferences may be and wishes, ahead of time. And then finally, for testamentary capacity, which we didn't really get into, but that's being able to write or change a will. I think it's important to kind of make sure that all of those documents are in order, because, if there is evidence of more advanced cognitive changes, those sort of documents can easily be challenged in court. So, I think overall is getting the paperwork kind of ready and do it early, so that the patient has as much say and ability to kind of direct those things as possible.
Easier said than done, Tori, because I wonder how many people in their 20s and 30s fill these important documents out, even though we know it's so important.
I am guilty myself. I was just thinking the other day with my husband, I was like, we probably should do this. We should probably do our advanced directives, but it's so important. I mean, those come in handy at any age, really. So, that's something that most people should really think a little bit more about.
One tip I've been asking or giving to families is when you do have an activated power of attorney, take a photo of it with your smartphone because you might go to a healthcare emergency room, hospital where they don't immediately have the record on file and you can show them the activated paperwork on your phone. And I don't think that's legal per se, but I think at least they can show this form is here. So eventually they'll get it. For the listeners, eventually the hospital will get it. But in the meantime, it might be nice to have it at your fingertips.
Yeah, that's a great strategy.
All right, Tori. So to end today, will you be talking on this theme of capacity at your upcoming Healthy Living with MCI event? Or did we just cover it all here in the podcast?
We did cover quite a bit. And, my upcoming Healthy Living with MCI talk doesn't specifically address the issue or topic of decision making capacity. However, I do plan to go into some additional details about how different types of dementia specifically impact areas of the brain early on. So, what are some of the changes in the brain for Lewy body versus Alzheimer's versus vascular sorts of dementia, and how do these manifest cognitively? So, what are the cognitive symptoms that we tend to see related to where these pathologies start in the brain? So, that's going to be a big focus of this talk, and really just how neuropsychological testing in general can be used as a tool to help us arrive at a good diagnosis. But, I capacity is close to my heart. I've really enjoyed my kind of work in this area. I was really pleased to be invited back to talk about capacity on the podcast.
No, thank you for coming back and giving us such understandable explanations and details. I think those of us listening, have learned a lot from you. And for those that are considering attending, please go to the Wisconsin ADRC website and learn more about the Healthy Living with MCI series. And you can sign up for Dr. Tori Williams' session titled Cognitive Testing and Brain Imaging Explained. And that's going to happen live on September 12th, 2025. And of course, it will be recorded and available online too. But thanks again, Tori.
Thank you so much.
Thank you for listening to Dementia Matters. Follow us on Apple Podcasts, Spotify, or wherever you listen, or tell your smart speaker to play the Dementia Matters podcast. Please rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. If you enjoy our show and want to support our work, consider making a gift to the Dementia Matters Fund through the UW Initiative to End Alzheimer's. All donations go toward outreach and production. Donate at the link in the description. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center at the University of Wisconsin-Madison. It receives funding from private, university, state, and national sources, including a grant from the National Institutes on Aging for Alzheimer's Disease Research. This episode of Dementia Matters was produced and edited by Kaylin Rowerdink. Our musical jingle is Cases to Rest by Blue Dot Sessions. To learn more about the Wisconsin Alzheimer's Disease Research Center, check out our website at adrc.wisc.edu. That's adrc.wisc.edu. And follow us on Facebook and Twitter. If you have any questions or comments, email us at dementiamatters@medicine.wisc.edu. Thanks for listening.